Looking forward to hearing your presentation about how you are responding to this crisis in the age-friendly community of Great Manchester. I give you the floor. We are listening to you. Welcome. No, we can't hear you. Hold on. Just 1 second. We're going to make some tests.
Can you hear me now?
And hopefully, yes.
Okay.
Now go ahead. Yes, we can hear you now, I think.
Thank you so much. It's a huge honour to take part in this event and to take part in this event with my colleagues Chris Phillipson and Tom Scharf. And I should mention at the outset that I was a student of Tom and Chris, and probably I think it's fair to say still am their student. So I'd love to be joining you in Bilbao and to enjoy the Basque region, but we are where we are in a slightly overcast Manchester. So if we move on to the first slide, please, and the next one. So I wanted to cover three topics really in my allotted time. The first one is to describe what the Greater Manchester Ageing Hub is, what its ambitions are, how we involve different stakeholders and not least groups of older residents in our work. Secondly, I want to set out the measures that we've been taking as a city region and as a group of agencies during the last 9 months or so. And then I just want to set out some of the things that we're planning into next year and beyond. And hopefully what you will see through this presentation is commonality in terms of conceptual approach, but also practical implementation with the two presentations that you've already heard from the UK this morning. Next slide, thank you. So the Greater Manchester Ageing Hub was established in 2016 to coordinate a strategic response to the opportunities and challenges of ageing populations. Greater Manchester is a regional authority of 2.8 million people, 10 municipalities, and our mayor, elected mayor, Andy Burnham. Mayor Burnham was the health secretary in the last Labour government and is a high-profile politician here in the UK. Ageing is one of the 10 priorities in the Greater Manchester Strategy, and we joined the WHO's Age-Friendly Communities Programme in 2018 as a city region. I mean, I should add that Manchester, where I worked for before Greater Manchester, joined the WH programme in 2010. And this is work that I've been involved in on and off, I guess, mainly on since about the mid-1990s. And we also have a strategic partnership with the Centre for Ageing Better. So the Centre for Ageing Better is a what works centre here in the UK, focused on ageing, and we've had a very strong partnership with them. Next slide, thank you. So, I mean, the case for change in Greater Manchester is very similar to the rest of the UK and indeed Western Europe and North America and other parts of the world. But it's always, it seems to me, critical to continue to make the kind of outline of this fundamental change in the demographic profile of our populations. And we continue to make the point that when we're sat in local government and other agencies in 20 years' time, there's places in which we live and work, the economy, the social relationships are going to be fundamentally different than they are now, and that we need to plan for that change immediately. And COVID has demonstrated the need to do that. Next slide, thank you. So this is a map of Greater Manchester, and I guess our point here is, and again, echoing points that have already been made, is that people are ageing unequally in Greater Manchester. So where you can see the darkest blues, I think it is, are in the inner city areas, really. And these are where you've got the highest levels of people on out of work benefits in their 50s and beyond. And that obviously is a significant challenge for us. Because you're out of work in your 50s and on low incomes, the likelihood is that you're going to continue that pattern into later life. We also know that around about 50,000 people of pensionable age in Greater Manchester currently live in poverty. And we know that there are significant concentrations of income deprivation in different areas of Greater Manchester. Most worryingly, in some respects, is the analysis from colleagues at the University of Manchester and elsewhere that the inequalities for the poorest 20% of our older population in relationship to the rest of the older population are actually growing in terms of health and poverty and so on. So we have the prospect of and the demand really to focus on this poorest 20% in our programs. Next slide, thank you. So I put this in really because this is one way that we try and explain to our colleagues in public health agencies, in local government and the NHS, the relationship between the work that we lead and current other, if you like, stories or narratives of aging. And it draws really on the conceptual approach that Tom set out and on the literature associated with the kind of critical social gerontology movement. So what we try and describe here is that our work is not just about the kind of biomedical or social care gaze, which sees older people as patients or customers, which tends to focus on the scale of the individual or the family, and talks about commissioning for very small numbers of older people. What we want to do is focus on and think about older people as citizens with agency. We want to focus on the scales of neighbourhood and city. We want to promote social capital and participation, reduce social exclusion, and change social structures and attitudes towards ageing. This is a huge ambition in many ways. But unless I think you get this story right, and unless you argue these key points in the arenas in which we work, then you're unable really to assemble the coalition of partners you need to do. So next slide, thank you. So in 2017 and 18, we published our age-friendly strategy for Greater Manchester. And these lines that you see before you represent the 10 boroughs with the different age profiles. So the third one down you can see has this kind of younger people's bulge that between about 80 and 25. And you'll see some of the other authorities have a lot older population. So there is significant differences across Greater Manchester. The other thing about this slide is that it's homage to the well-known Manchester rock group Joy Division and their album Unknown Pleasures, and is a rather crude device to engage the middle-aged men and women in Manchester who make decisions about budgets. But that's maybe a discussion for another time. Next slide, thank you. So we have been working on a recovery strategy, and I'm going to go into detail in some of the other slides about some of these elements. But these are the themes that we've developed with our partners. I'll pick up the narrative issue elsewhere and the employment and financial security. I'll mention homes. So we have a significant program of work trying to integrate issues of population change and demography into Greater Manchester's plans over the next 30 years for its housing stock and its urban design. And these are always significant challenges for us. Because particularly in the UK, these developments are driven by developers and by kind of market interests, and less so by the abilities of citizens and local agencies to shape those things. I'd also highlight this issue of digital inclusion or exclusion. In Greater Manchester, something like 200,000 people do not regularly use the internet, of which 80% of those are 65 and over. So when I come on to other slides, I will describe the measures that we're taking around that. And last but not least is the focus on inequalities around not just, I guess, poverty and social class, but of ethnicity, gender, sexuality, and disability. So this is the kind of framework that we are using in the next stage of our work. Thank you. I just wanted to mention a couple of ongoing pieces of work which we think are critical. So the first one relates to issues of older workers. We know from data from earlier in the pandemic that the impact on workers is a kind of U-shaped impact, with the biggest impact on younger workers, but also an impact on older workers. And what we do know is that if people lose their jobs, particularly those on traditional skills, or not, or people who don't have digital skills, that the chances of getting work if you lose your job in your 50s before state pension age here in the UK are very low. So we're taking specific measures, working with our GM agencies and with national agencies to try and work out how we can support over 50s back into work with specific programs around across a range of different issues. We've also launched a new agency which is called CADA, which is a creative ageing development agency, and we're looking at the next phase of our work around Culture Champions, which is a program for engaging particularly people on low incomes through cultural organisations. And we've just submitted this week a bid for £12 million to establish a agency for age-friendly design and a new platform for socialising tech-enabled care. Thank you. So this is some of the work that we've been doing over the last few months. I should say, in addition to this, the whole of the GM system has been mobilised to provide community response in terms of food and medicines and so on. And our housing organisations have been providing regular phone calls to people who are at risk of isolation. But these are some of the specific things that we've done as an ageing hub. The first thing is that we produced a booklet which you can see called Keeping Well at Home, and we distributed those to 70,000 people in Greater Manchester, and has been syndicated by 9 other local authorities in the UK and also in Australia and Canada. We've also published a creative care kit, which you can see there, which went out to 15,000 residents, which was a guide to staying creative or being creative during this time. We've run a campaign called Valuable Not Vulnerable, which is a series of resources and films trying to disrupt this ageist narrative that we have. And we've also worked with colleagues in Micra and elsewhere to gather research analysis and insight into how older people's are doing during COVID. And we've produced new guidance and practice with our colleagues in the voluntary sector in our Ambition for Ageing programme. And we've also worked with our UK network of age-friendly communities, which has 44 members. and with our European and international network. So we've just published with Zaragoza, excuse my Spanish, and Barcelona, and a range of other European cities, a new set of reports called Adapting Cities for Population Aging, and I'll mention more about that at the end. Thank you. Next slide. So I just want to move on to our present campaigns. So this one is Keeping Well This Winter. We have some key messages because we're worried about this process of deconditioning, physical, cognitive, and I guess emotional deconditioning, which is a huge challenge for people who are staying indoors at the moment. So our key messages around keeping active and connected, staying safe and well, but also advising people on money and their home improvements. You can see one of our older people's activists being interviewed for a film that we made just out of his house, side of his house here. And the campaign resources include 150,000 printed copies going out across Greater Manchester as we speak. We have a film co-produced and fronted by older people talking about the things that are important to them. That's on YouTube. And we've also provided a talking tips guide for conversations about keeping well that frontline staff and older people themselves and families can have with their older family members and friends. And that's being distributed with our colleagues through the fire service, police, housing organisations, social care agencies, and so on. And we are currently mobilising these resources across the city region. Thank you. We are also running a campaign focused on increasing the income of the low-income older people. We have an entitlement here in the UK called pension credit, and around about £100 million goes unclaimed each year in Greater Manchester, and it's worth on average £3,000 per family. So we are targeting people eligible for this benefit over the next few months. Thank you. And I just wanted to say how we're working internationally. We, as I mentioned, just finished work on the ACBA project. We work in the Eurocities Urban Ageing Working Group, and I would encourage Basque cities and larger towns to look at being involved in that programme. We also work in the European Innovation Partnership as a 4-star reference site, and through MICRA in the academic partnerships. We've also published a local industrial strategy here in Manchester, which has commitments to establish a new innovation partnership on action for healthy ageing around developing new goods and services for this idea of a longevity dividend. And we are planning to establish a new international centre to enable us to do that. Thank you. So just some next steps for work that we're doing. We are building our movement, our age-friendly movement, through our 10 municipalities. We are increasing the capacity of sharing good practices across our 10 authorities. And absolutely critically, we are building older people's participation and voice. We are also building our 53 mayoral challenge areas, which are areas where local communities have come forward to make their local communities more age-friendly. And we are building for a new Ageing Well programme. And last but not least, continue with our international work. Thank you. So our slogan is doing ageing differently. We want and we are committed to creating better lives for older people by working with older people and by working with a wide range of agencies. It's a great honour to be able to finish my contribution this morning, and I look forward to the next time we meet, which I'm sure will be in the beautiful city of Bilbao or San Sebastian or close by. Thank you very much.